Build Back Better has been the repeated theme of those looking to create a more just society in the aftermath of COVID-19. I couldn't agree more. But I would add, when it comes to worker health and safety, we already have a solid roadmap. We need only follow it. Hello, I am Dave Killham, Executive Director of the Workers' Health and Safety Centre, Ontario's only labor-endorsed, government-designated training centre. As we observe our National Day of Mourning this year, we remember workers who have been injured, killed, or made ill from all work-related causes, including the virus that causes COVID-19. Remember, though, it is not enough to mourn. We need action too. Why we call ourselves a movement. What form this action should take has been long understood. Ontario employers must take every reasonable precaution to protect workers. Workers and their representatives must play a full and meaningful role in workplace health and safety matters. Quality training is needed to support these efforts. Better laws and vigorous enforcement are needed too. These conclusions were supported by two extensive studies of Ontario's public health and occupational health and safety systems, both in response to two preventable tragedies and both accepted by the government of the day. With his final SARS Commission report 15 years ago, in 2006, Justice Archie Campbell made recommendations, including the absolute need to implement the precautionary principle to guide swift, prudent action in the absence of scientific certainty, and the need for proper attention paid to worker voices of concern. 4 years later, in 2010, an expert panel comprised of occupational health and safety specialists representing labor, employers, and government, led by Tony Dean. These specialists made recommendations for a new approach for Ontario's health and safety system, including enforceable training standards, standards to ensure quality training, to help meet requirements of Ontario's Occupational Health and Safety Act and regulations, such as WHSC. Training for worker health and safety representatives in smaller workplaces. Training for working at heights in all sectors, not just construction, as well as training for significant hazards in all sectors. Entry-level training for construction workers and workers in other sectors as well. Today, after years and years, literally decades of inaction, promises of all these recommendations have gone largely unfulfilled. We need only look around us to see this much. Early and growing evidence of COVID-19 airborne transmission has gone unheeded, leaving workers without the precautions of proper masking and enhanced ventilation. Toxic disinfectants are still widely used despite the availability of safer, effective alternatives. Many joint health and safety committee concerns have been ignored. Discussions around mandatory training standards have stalled completely. As a result, workers have suffered unacceptably, particularly immigrants, migrants, and workers of color. Complete worker compensation statistics are yet not available for 2020, but we know more than 20,000 workers submitted claims for COVID-19 illness and another 46 for COVID-related death. And we know all claims are significantly unreported, maybe as much as 70%. Several studies have also uncovered the pandemic's considerable toll on worker mental health. The time for study, however, is over. We know it works. So today, let's mourn for the dead. But every day forward, let's fight for the living. Let's insist on taking all reasonable precautions to protect workers. And let's insist on mandatory training standards and quality training in aid of this very achievable goal. As a health and safety movement, we have learned persistence pays. For our part, we at the Workers' Health and Safety Center are dedicated to ensuring you get the training you need. Hazard-based, prevention-focused, worker to worker, where and when you need it. Working together, we can save lives and livelihoods. Thank you.